Hi everybody, it's Dr. Newman. During my discussion about breast lift surgery, I frequently see patients who have breast asymmetry, where one breast is larger than the other to start with. So part of my conversation about breast lifts for them is not just lifting their breasts, but also making their breasts more even. So patients then are curious about, well then how will I age after that? And it's an interesting question because kind of in the old days when we dealt with breast asymmetries, for patients who didn't really need breast lifts, we frequently would just use two different size implants. Nowadays, because that larger breast is typically also a lower breast, and that breast typically requires some kind of breast lift at the same time, rather than using two different size implants, I'll use the same size implant, but reduce the amount of natural tissue on one side so that it matches the other side. And there's a reason why I do that, because when one breast has a larger implant but less natural breast tissue, and the other breast has a smaller implant but more natural breast tissue, the breasts age differently. The part of the breast that's underneath the muscle gets some support from that muscle. So the part of the breast that is your implant doesn't really age so much. It's really the part of your breast that is natural breast tissue that's only supported by skin that's aging. Well, if you have more breast tissue supported by skin on one side and less on the other side, follow those patients down 5 or 10 years, the side that has more natural breast tissue droops a little bit more than the side that has less natural breast tissue. So by me doing what I term a plus-minus procedure, where plus because I'm adding an implant, but minus because I'm taking away tissue, my goal is to end up with two breasts that have roughly the same size implant and the same amount of natural breast tissue that corrects their asymmetry, but also corrects somewhat the way that they're then going to age as time goes on.